Hello, my name is Markus Römer. I'm a consultant and auditor for the pharmaceutical and medical device industry. In one of our last detox sessions, I was talking about Part 11 very quickly and saying, yes, basically it's already solved, or it's we know how to handle it. And so that triggered me to do one session only about Part 11. 21 CFR Part 11 is guiding me through my entire career now, and it seems that if new topics are coming up like data integrity, or even it was during PET, for example, that it was coming up again and again and again and again, and so it's worth to have a view on that. What we should always consider, for example, if we write a user requirement specification, and sometimes I must read just one requirement saying the system should comply with 21 CFR Part 11. This is very vague. This is maybe not appropriate. It's a little bit similar, like you would write a requirement, the system should run under Blue Heaven or something like this. So it's very general. It makes sense to have a view in the history of the requirements, the regulatory requirements, and the entire progress of the things that happened. So we will do a short time travel today, and I shared my screen again here with you, and you see already in the PDF viewer that we have a lot of things to read, but I will try to make it as quick as possible, not forgetting any detail. So we have a look into the Federal Register of the US-FDA, and now we go back to 1997. Basically, we should go back to 1994. The US-FDA was planning to write 21 CFR Part 11, titled with electronic records and electronic signatures. By the way, the validation requirements of a system, for example, for CGMP, are in the Predicate rule, Part 211, for example, 212, and you will find that in other areas. It's not a validation guideline. It's going to electronic records and electronic signatures. And even if you would look at from 1997 and now 2024, it is allowed and it's still practice to use hybrid systems. So you have an electronic record and you define your master record to be the paper printout. That's still appropriate, and that could work. We are moving now more to whatever Pharma 4.0, Industry 4.0, digitalization projects, and so on. But we still have this situation. So if you have listened some GMP Detox sessions before, you might have realized that we have a view on the things also from a regulatory point of view. We want to have a view into the structures, in the methodology of regulations and laws and so on. And there was a commenting phase, like for any regulation, for any guidance for industry document. And if you open Part 11, I'll make it short now, Part 11, 21 CFR, Part 11 on the Federal Register, the comments that were provided between, I think, 1992, 1993, and 1997, the FDA received 49 comments on the proposed rule, and the answers are put before the final law. So you see 49 comments, that's quite a lot. To be fair, if you think about what kind of smartphone or PC you had in 1996 or 1995, you didn't have a mobile phone at this time. I had a computer, IBM Model 30, with a hard disk drive of 20 MB. So that's quite a long time ago. So some comments might be outdated, and we didn't know which ways to go at this time. So okay, so I needed to go to page, what is it? Page 36. Then part 11 is starting. Finally, part 11, electronic records and electronic signatures. All before that are the comments given and answered by the US-FDA. And part 11 does have basically three subparts: subpart A, B, and C, general provisions, then subpart B addressing requirements for electronic records, and subpart C for electronic signatures. Even from 1997 on, there have been a lot of changes also in signature laws. So in any country that you are, have also a few on the applicable signature laws. So this is part 11, 11.1, 11.2, 11.3. Those are the different sections. And maybe it's a little bit funny looking from some years now. We will have 30 years in 2027 and so on. So controls for open systems, for example, per definition, we would not use open systems and so on. We have closed systems, or you access data outside of your company with a VPN connection. So there are also some freaky things in it, maybe something like this. And my I had the feeling at this time that the idea of the US FDA was to not only to encourage the industry to go on electronic signatures, even the technology was not really made for that in 1997, but demanding a little bit more of the industry so that they get the minimum requirements. I'm not sure that's maybe not fair as speculation, but a lot of requirements were really complicated, and especially at this time. We were thinking on a pH meter how to implement fingerprint or iris scan, retina scan, and scan, and so on, to provide an electronic signature. That was a little bit crazy, but it's a long time ago. Additionally, the US FDA have written additional good guidance for industries. So in August 2001, there was a very motivated inspector. And so at this time, I had the feeling week by week, we get a new guidance for industry. You understand? Part 11, predicate rule, final rule, 1997. And the FDA was putting additional documents which are non-binding to different topics of Part 11. So one of that was Part 11, electronic records, electronic signatures regarding validation, right? It was a little bit bizarre at this time if you read things like here, internet validation. Okay, we cannot validate the internet, and the US FDA was saying that too, but you see at this time where we had the thoughts on which topics. Then already in July 2002, again, somebody was drafting and the second guidance for industry, Part 11, maintenance of electronic records. Very quickly, in August 2001, we also had the glossary of terms. Chronologically is not perfect, but you see all four different guidance for industry documents. And one was then the electronic copies of electronic records and so on. So Part 11 should be supported by additional guidance for industry documents, and quite a lot of them. None of them was finalized, so the status is never final. And after 6 years, the industry felt really uncomfortable with Part 11. And if you want to complain about something, because the entire approach was very restrictive, it cost a lot of money. If there was created any added value, I have serious doubt on that. So if you want to complain about something, maybe it's not the best thing to take your own company paper and to write to the US-FDA with a public letter or something like that. What is quite very good if you take an organization, a well-known organization. So this letter was written by the ISPE. You will not find an author. You will not find any company name or something like that. But the industry was massively complaining about Part 11, and not only complaining, they were also proposing a risk-based approach to Part 11, because it was impossible, even from a technological point of view, and even nowadays it's not so easy to say we don't have any paper anymore anywhere in our company. We work on that, yes, but it takes time. So the ISPE has written this public letter. I cannot find out when this was published. I think it was the 16th or the 18th of February, maybe the 21st of February 2003. I just say around February 2003. And you will find there something like a message: we are not willing to spend more, whatever, dollars, Deutschmark, Swiss francs, pounds on Part 11 compliance. We get so many guidance for industry documents, and it's very hard to do so. Okay, so this is how the answer of the industry was. 1997, Part 11, then 4 good practice guides. So the statement is: without careful interpretation, however, the requirements can lead to over-engineered solutions that adversely impact the productivity of the industry without providing added benefit to patient health. And below that, they suggest a risk-based approach. So that was mid-February. And now we go to the next document, again to the Federal Register, also in February 25th, 2003, of the US-FDA. And they were announcing that they now write again a draft guidance for industry document, Part 11, electronic records, electronic signatures, scope and application. Whenever you talk about Part 11, you must keep also in mind the guidance for industry. In short, I call it scope and applications. And if you think about that the ISPE has written this public letter mid-February, and the answer was coming from the US FDA on the 25th of February 2003, we could imagine that the agency was working in light speed, extremely fast, to say, okay, listen, industry, we understand your problems, your complaints, your challenges. That was a very, very fast reaction. And it was going directly here to the different complaints and issues that were formulated by this public letter of the ISPE. So, then in August 2003, I think even this is very fast for a guidance for industry document from February to August. They put in the final one. What is interesting in this document, I just highlighted some of the things. Now we have 2024. FDA is re-examining Part 11. while the re-examination of Part 11 is underway. I think it's still underway. It looks like that. What is also important to understand, note that Part 11 remains in effect. There's nothing on that, but always in the combination with the guidance for industry scope and applications, if you would ask me. So, and the guidance for industry documents that I have shown to you, validation, glossary of terms, timestamps, maintenance, and electronic copies, they have been withdrawn on one day, all of them. So I think that was for the pharmaceutical industry, for us, quite very good, because these documents caused so many confusions, and that was very irritating. So so they have withdrawn the Part 11 draft guidance documents on validation. They announced that a re-examination of Part 11 will come. Part 11 is still applicable and will be inspected, but it is allowed to start with a risk-based approach. In the ISPE document, for example, if you scroll down, they announced we would like to do a top-down approach. So is it a GXP record, yes or no? Then rather than a button-up approach to say anything of an electronic record must fulfill Part 11 and must have an electronic signature, and hybrid records are not anymore allowed. So that was the message, and also to say what are critical records. And within Part 11, if you look on systems today, there are still the requirements limiting system access. I think it's hard to find a system without user management or without operational system checks, with device checks. However, this is done. Controls for open systems, I think it's not applicable for today. We would not run such systems. And so that's the scope and application document. Persons must still apply with the applicable predicate rules, like 211.180, master batch records, batch production records, and so on, for sure. In addition, paper and electronic record and signature components can coexist. So in the European Annex 11, it's called also hybrid solutions, for example. You must meet the requirements for sure. But so this is what happened in the history of 2003. I must also say, if you have a view on the final rule here, the different sections, I think it's very important to understand whatever solution you are looking at and whatever you design. You can still say we use a handwritten signature on electronic records, so you have this hybrid solution. In whatever 99% of all cases, you will say we provide the electronic signature, which should be an advanced electronic signature, not a qualified electronic signature, not a digital signature. Within the boundaries of your company, you can define to use an advanced electronic signature. So you have scenario number 4 here in this table. You see that just from the look and feel that this is an older document, but it helps me to find a good solution for Part 11. What are the applicable sections? So whatever you choose, and in 1997 we were thinking about whatever retina scan, iris scan, voice recognition, how we will do electronic signatures in future. Again, think about 1997, right? So you see here the electronic signature based upon ID, code, and password, but not all sections of Part 11 would apply. I find that sometimes a little bit bizarre. If I get a white paper from a supplier and they say all Part 11 sections, all Part 11 requirements are covered by the system, and then I ask, you can also sign with biometrics, and they say no, only with ID code and password, user ID and password, and they say, oh, that's funny. but you answered also the requirements in 11.200 number B, for example. And then I get doubts if part 11 was really understood, because there are different scenarios possible to sign documents, to approve documents or something like this. So even now, we continue the time travel. If I say the things are already solved, they have been solved maybe within different generations of an organization. Some knowledge was lost maybe. In 1999, 2000, I was part of a GAMP special interest group, what is called today a COP, Communities of Practice, for example. So what was done? I only have the draft version. It took me this morning 1 hour. I was searching at the ISPE website if we still have the GAMP Good Practice Guide complying with electronic records and electronic signatures. I have not found that. There were different initiatives together with the PDA, and we created something like the GERM, the Good Electronic Records Management guidelines and so on, but I was not able to find it anymore. Maybe it's a long time ago, but what you see here, and I think I can share that because it's a draft version, that we were analyzing part 11, each and every clause, and we put in what is the type of control. We were talking about procedural controls, for example, if a developer must be trained on GMP or something like this, and what must be provided on a technology basis. For example, the function of an audit trail or something like this. So we have taken every single clause and defining the type of control. And now it's a shared responsibility. Part 11 compliance is a shared responsibility between the contract giver, for example, the pharmaceutical company or the medical device company producing that, and the contract acceptor, the supplier of the system. Maybe it's a single system, an application, something like this. We put in their in the column responsibility. You see P for the pharmaceutical company, could also a medical device company, and the supplier. And this is also very important. It's a shared responsibility, and we try to define these requirements in a more execution way. You see that it's only 3 pages, and to say, okay, who is responsible for it, and is it a procedural requirement or is it a technical requirement? I think that's extremely useful, that you first think about which scenario do I have, which sections must I comply. I have a handwritten signature, so it stops here at 1170, for example. Then you check what should be done. Is it procedural? Is it technological? And who is responsible for it? Just be careful. If a supplier is telling you part 11 is no problem, you only need to sign the white paper and that's it. No, there are things that must be done for part 11 compliance. None of these requirements are out of this world. If you look on here on what is needed, limited system access, authority checks, operational system checks, these are today basic requirements of a computerized system and an application that you need to validate or so. Okay, so first look on what kind of scenario you have, which sections do apply for you, then the GAMP document here providing which clause, what type of control, who is responsible, and then you follow the notes, what needs to be done. As an example, this is today not a reaction video, but for example, why not? Most of you will know Microsoft. They also have a white paper, for example, for that. You find that very often, sometimes not. It's just sold to you, ready to use, part 11 compliance, don't care. That's not true. But you see here the part 11 requirement, the original text taken from the final rule. And here, what is the responsibility of the customer and what is the responsibility of the supplier? In this case, it's Microsoft. Nicely done. What are the responsibilities? And then you can go for the Part 11 compliance. But don't trust someone to, if the guidance for industry scope and application is not known, if a system, an application is sold to you with Part 11 compliance, it's already in there. There are things which are in your responsibility. For example, from a level of technology provided by the supplier, you should be able to manage different user accounts, user groups with different user rights, for example. But it's your duty, obligation to assign the right people in your department, in your company to these roles, to provide something regarding data integrity, for example, segregation of duties, that you fulfill this. Also, general CGMP or GMP requirements on a general view. So that was a little bit history of Part 11. Some important things to consider. Don't forget the guidance for industry, scope and applications of Part 11. I'm looking forward when the US-FDA will finish this re-examination and write the new Part 11, an updated Part 11. Why not? Especially now with cloud service providers, AI, ML, and so on. There are a lot of topics that could come up. In the moment, personally, I do not know when this will happen. But in the meantime, maybe it will still be another 25 years, something like this. Apply the guidance for industry, scope and applications. Decide what kind of scenario you want to follow. Hybrid records, electronic records signed with user ID and password, and derive the requirements out there. Do your own interpretation and follow a risk-based approach, a top-down approach from the quality decision-making process down to your record, and then you define how you manage your records. It's very close also to data integrity or data management, data flows, and then you apply where you need to have an electronic signature, or if you still want to use handwritten signatures. This is possible since 2003. If you want to have stable processes and a good, let's call it datability, you can use your data not only for decisions made batch by batch, but also to have statistics and so on, and to do whatever, if needed, investigations of if you have OSs or something like this. Then you will see managing it with electronic records and having electronic signatures, it will be a bit benefit for you. Yeah? It's putting added value into your processes in your products, and finally to our patients. Okay, thanks so much. Let me know if you like that. Give me a like, subscribe to the channel. If you need to have some more information, please let me know. I was not happy to say to see today that some great GAMP resources are not anymore available. Maybe I will talk to the ISPE that we do an update here in the style of how we did it today, to understand a little bit the history of Part 11, what happened, what will happen. We will see that. Okay, thanks so much. Have a great day. Bye-bye.